Section 1.4, we're going to talk about collecting data. So we've done a little bit about how to organize some data, but now we're going to talk about how we can collect it. Okay, so first is talk about causality. Okay, so to establish causality, you need to show that an outcome is affected by some treatment. So a lot of what we're going to talk about is the difference between experiments and observational studies. So a treatment group is just the individuals who receive the treatment. So if you think about some medical experiments, you might have two groups where one gets some drug that's supposed to help lower the blood pressure, and the other group just gets a placebo pill that doesn't really do anything. Okay, so in that case, the treatment is the blood pressure medicine. Okay, so the control group are the individuals who do not receive the treatment. So in the example I just used, the control group would be that group that would be getting the placebo. So that's a treatment group and a control group. Okay, so another example is one I have here to see if online homework improves students' grades. So you have 550 students using online homework and 500 students not using the online homework, and they were observed, and then we would continue, and actually to finish this study we would look to see if the students using the homework, online homework, if their grades were better than those who didn't use the online homework. Okay, one thing you need to watch for is anecdotal evidence. I'm sure you all heard the story about, your great-grandfather who sat around drinking lots of vodka and smoked cigars all day long and lived to be 92. Okay, so that's just a statement about one particular person that lived a long time based on some certain attributes or certain things that he did throughout his life. You should never use that to make statements about general groups. It's just called anecdotal evidence. Okay, so we have observational studies and experiments. So in an experiment, you put people into groups and you apply some treatment to them, okay, and then you record the difference between the two groups. In an observational study, the groups are usually self-selected. So if an outcome occurs more often with one of the groups than the other, we say that the treatment and outcome are somehow associated. So back to the blood pressure example, if my treatment group, so the group that got the blood pressure, if it actually lowered their blood pressure, then we would say that blood pressure and the treatment, which was my blood pressure medicine, are associated with each other. Okay, just because you have association does not mean you have causation. Okay, causation means you have to have some reason to say that X causes Y, and you can't always do that in an observational study. You can't always do it in an experiment if it's not a well-designed experiment. Okay, so an example says people with gray hair are observed to have more wrinkles. This does not mean that gray hair causes wrinkles. Okay, we have what we call confounding variable. Okay, so if you read my statement here, so for example, what causes both gray hair and wrinkles? And if you need to pause the video for a second to think about that, you can do that. Okay, so what does that? Old age causes both gray hair and wrinkles. Okay, so that's what an example of a confounding variable. Okay, so just yet because you have an association between the treatment and the outcome, such as over here, does not mean that you have causation. All it means is that you just have some association. We'll talk more about how you end up with causation on the next couple slides. Okay, so you can have what we call a controlled experiment. Okay, in a controlled experiment, so each individual is assigned to either the control group or the treatment group. Okay, you should have large sample size because we always have variability. Okay, and the assignment should be done randomly. The idea of doing the assignment between the two groups randomly is so your goal is to have the two groups similar as possible before you ever start the experiment. Okay, in the next video we actually have a little example where if you don't assign them randomly, it's hard to determine which method works better. But you also have to watch out for the placebo effect. And this is just where people feel better just because the doctor says, oh, I'm going to give you something, even if the medicine he's giving you is nothing more than a sugar pill. Okay, so just being told that this is going to treat you sometimes just makes people feel better. There's actually a nice episode on MASH about the placebo effect if you've ever watched MASH, there's Major Winchester is convinced that there is no such thing as a placebo effect, but he actually ends up talking to a soldier that was given a sugar pill because they were out of pain medicine, and he's actually said, "Oh, I'm feeling not as much pain now." Okay, so when you do an experiment, you try to do what we call a blind and if possible, a double-blind experiment. Okay, in a blind experiment, the participants won't know which group that they're in. Okay, so they don't know if they're in the control group or the treatment group. Now, depending on what the treatment is, sometimes there's no way you can do a blind experiment, such as if my two groups, maybe one's getting physical therapy and the other's not. So in that case, it's hard to make it a blind study because those getting physical therapy actually know they're getting physical therapy. Okay, if you can make it a blind study, then even a double-blind study is better. And that's also the people who are going to be administering the treatment or even evaluating the people as they do go through the treatment program, that they shouldn't know which group, control group or treatment group, that the person is that they're evaluating. Okay, so here's an example. So a researcher wants to determine whether a multivitamin pill shortens recovery time for the common cold. So the researcher prepares 300 bottles of the multivitamins and 300 bottles of identically looking placebo pills. And the bottles are marked with serial numbers that only the researchers can decipher. So the pharmacist did not know which are which, but writes down the numbers in a log. Okay, so as the patients would come in to get their either multivitamin or placebo, the pharmacist would, all he'd do is just look and say, "Oh, this particular person gets this bottle with that code," and he hands in the bottle. He has no clue if he's actually given placebos to that person or if he's given them the multivitamins. Okay, and then the person taking it also won't know what they're getting. They just know they got a bottle of something that looks like multivitamins, but they wouldn't know which they actually got. Okay, so we do random assignment to control bias. Okay, so the best way to do random assignment is like with a computer. There's several websites out there also you can use that would randomly assign people. Okay, so bias occurs when the assignments are not random and the results are influenced in a particular direction. Okay, so here's my example, is giving tutoring to the first 15 who register for a 30-student class to see if tutoring helps with exam scores. Well, who's likely to show up to class first? Probably your better students. So in this case, your better students might actually be getting the tutoring, in which case you don't know if your students who were getting tutored were similar to those not getting tutored before they got started getting tutoring. So this looks like probably not, because your better students would be in the tutoring group. So now you don't know if it's the tutoring that got them the better grades or it's because they're the better students that actually arrived at class first. So if we randomly assign who gets which, hopefully we can avoid the bias. Okay, so there's a gold standard for experiments. Okay, first you should have a large sample size. Okay, so this assures you that you're getting lots of variation among both groups, both the control group and the treatment group. Okay, it should be controlled and randomized. Okay, again, randomization is so that you can minimize your bias. You should make, if possible, your experiment double-blind. Okay, so nobody knows who's in which group, except there's some record somewhere. Okay, and the last thing is a placebo, which kind of goes along with the control group. Okay, so that way you can control for possible differences just by if there's a because of the placebo effect. Okay, so here's an experiment that was done in 1954 about the Salk vaccine. Okay, and this was to control for polio. Okay, so in 1954, the first vaccine against polio, known as the Salk vaccine, was tested on a large randomized double-blind study. You should actually recognize what all those words mean. When we talk about it, large, that was one of the gold standards. It was randomized, that was a second gold standard. And it was a double-blind, that was a third one. So far what we're missing is the placebo. Let me continue reading. So approximately 750,000 children were asked to enroll in the study. Of these, approximately 350,000 did not participate because their parents refused permission. Okay, the children who did participate were randomly divided into two groups of about 200,000 each. One group received the vaccine while the other group received a placebo. So right there is our fourth standard of a gold experiment. Okay, so the rate of polio in the treatment group was less than half of that in the control group. So that's telling me, let's say I had 100 cases of polio in the control group. Well, that tells me in the treatment group I had less than 50, because it was less than half of that in the control group. Okay, so that sounds like it actually was, it means the vaccine actually should have helped. Okay, so is it reasonable to conclude that the Salk vaccine was effective in reducing the rate of polio? And I would say yes, because it met all the requirements of a good, controlled, randomized experiment. Okay, so in this case, I can actually use causation. Okay. It says polio is sometimes difficult to diagnose as its early symptoms are similar to those of the flu. So why was it important for the doctors in the study not to know which children were getting the vaccine? So you might want to pause the video and think about that before I give you my explanation. So if the doctor knew if the patient coming in had the vaccine, or if they didn't have the vaccine, then when they came in to get treatment for something that looked like flu-like symptoms, it's possible that if the doctor thinks this vaccine is working and they know the patient they're treating had the vaccine, they're much more likely to diagnose those early symptoms as the flu. Okay, versus if a patient comes in and let's say the doctor knew this one didn't have the vaccine, then they might be more likely to diagnose these flu-like symptoms as polio. So that's why it's important that the doctors who's looking at the patients don't know which treatment that they're getting. Okay, so they also kept track of those patients who didn't get either treatment. Okay, so it says, perhaps surprisingly, polio was more common among upper income and middle income children than among lower income children. The reason is that lower income children tend to live in less hygienic surroundings. They would contract mild cases of polio in infancy while still protected by their mother's antibiotics, and thereby develop a resistance to this disease. So the children who did not participate in the study were more likely to come from lower income families. And the rate of polio in this group was substantially lower than the rate of the placebo group. Does this prove that the placebo caused polio, or could this be due to confounding? Again, if you pause the video and think through how you would answer this question, and then you can hear my response after you start it again. This part of the study that we're looking now actually is an observational study and no longer an experiment. Because what we've done is the patients or the children have now self-selected which group they're going to be in. Okay? They were either in the group that got nothing because their parents didn't sign the permission slip, or they were in the group that got the placebo vaccine. Okay? And we know these two groups are not similar to start with, because it says there are more lower income children whose parents did not sign the permission waiver. So in this case, since it's an observational study, there's definite confounding in here, and you cannot say that getting the placebo actually caused polio. Okay, it's because the people who didn't get anything at all actually had a less chance of getting polio to start with, because they were in that lower income where they were actually get mild cases of it while they were still protected by their mother's antibiotics. Okay, so in the next video we'll talk about, I think, or do this example of why we randomize.